So I know as OTs, we can be inundated with documentation, whether it's initial assessments, whether it's follow-ups, whether we're using standardized assessment tools or writing reports. The documentation can sometimes take hours and it can often lead to burnout. And sometimes you can feel a dread of just having to write that documentation after having a great experience or even an overwhelming experience with your patients or clients. So it helps when there's a tool to help reduce the burden of documentation. So we're looking at AI Scribe tools and how we can use them effectively to reduce the burnout and burden of documentation. So today we're going to look at a particular tool called Heidi and how it's going to use it to transcribe our scenario. I'm going to press transcribe now and then play a little bit of our scenario, and then hopefully it will transcribe it.
The patient, Mr. Johnson, is in an acute care hospital after hip replacement surgery. He is struggling with transferring on and off the toilet independently. The OT is seated near the bed. OT, good morning, Mr. Johnson. How are you feeling today? Patient, morning. I'm doing okay, but getting around is still a bit challenging. I tried to use the toilet earlier, and it was really hard to manage on my own. OT, I understand. Transferring on and off the toilet can be tricky, especially after surgery. It's important that we make sure you're safe and comfortable while we work on improving your independence. Can you tell me a bit more about what made it difficult? Patient. Well, I couldn't balance properly when I was sitting down, and getting back up was even harder. My leg feels weak, and I'm worried about falling.
So that's it. This scenario has finished. I'm going to stop transcribing and let the notes generate. So in a matter of seconds, it's generated our SOAP notes. I always recommend that the scenario, there's a written part for it. So if you just look in the description box, you'll see a link to download it so you can compare it from yourself. So the subjective, presenting following a hip replacement. In each work setting, and I guess in each country and each work setting, you will have your requirements for note documentation. I live in the UK, so we need to say the reason for the assessment. We need to mention consent in our documentation. We need to say who's reporting, whether it's the patient. And also we do our notes in retrospect in my setting. So it shouldn't be reports, it should be reported. So, but this is the standard SOAP tool SOAP template actually that comes with Heidi. You can customize to make it more specific to your setting. So the observations were good because the patient had difficulty with the toilet transfers. The patient demonstrated the use of the equipment transferring often on the toilet. So that's in the objective. The patient was successful in transferring, and they showed more stability. And in the assessment, reduced functional independence in toilet transfers following hip. Improved transferability noted with adaptive equipment and instruction. So in the plan, education provided in safe transfer techniques. So that was already done. So that shouldn't be in the plan. Equipment recommendations. Ideally in A, for us, it's A for analysis. So you will be putting that in your analysis, what you're recommending, and then plan is to issue it. To continue practicing transfers with supervision, yes. To liaise with physiotherapist. For further OT sessions, yep, that's fine. Home equipment set up to arrange prior to discharge. Yes, it depends who's going to set that up. Is it that you're providing the equipment for the family to set up and to take home, or that's a bit of a vague. That's a bit vague. Yeah, so I have my own template that I've tried to customize. I'm still tweaking because even sometimes with the prompts, the AI tool doesn't quite get it all the time. So this is my soap notes template for the UK. So let's see the difference. Okay, so we can see it says who's present, that verbal consent was obtained, the reason for the assessment is there. It still has reports instead of reported, but that can easily be changed. It has assessment there instead of analysis. That needs to be changed. In objective, initial observations demonstrated challenges due to lower limb strength and balance, which was reduced. Assessment conducted using toilet room with equipment and guidance demonstrated to improve technique, including So it's showing what was there in the objective, what was demonstrated. I wouldn't exactly write this. This is not my style of writing. So I guess what needs to be done is to kind of tailor the instructions so it has your writing style and the writing style of your setting. And that's just you needing to tweak the custom template more. Yeah. So even some of the things in the plan, that's not exactly the writing style I would use for myself, but it's got some of the information in there. So yeah, what do you think about this? Hi, my name's Jumi. This channel is called The Tech OT. We talk about health tech and how we can use it to improve workflow, patient outcomes, and patient experience. Right now, we're on a series about AI Scribe tools and how to use them safely and how they can improve our daily practice. So, what do you think about this? What are your concerns with the tools? The AI Scribe tools. What do you see the benefits are? I think they definitely will reduce documentation time if you have a template which is tailored to your setting. And even when you do, it's still best to review. It's still best to review and check the notes, just like if you got a therapy assistant to go and do something and they would feedback to you and you would check, okay, yeah, this is what I wanted, or this is the outcome, or how did you have a bit of a dialogue of what happened. That's how I see this AI Scribe tool, not for you to just use it and go by what it says, but let there be a review of what was documented to see if it matches up. And I think that would help in the safe practice of using AI in healthcare. So if you found this interesting, subscribe to the channel for more videos of health tech. And also there's a link for a newsletter for a weekly update of what's going on in health tech and some tips and tricks from us here at the Tech OT.